Leukemia: causes, symptoms, diagnosis, and treatment options. Leukemia is a complex and challenging group of blood cancers that affect the bone marrow and blood-forming tissues. In this health guide, we will delve into the various aspects of leukemia, covering its types, causes, symptoms, diagnosis, treatment options, and ongoing research. This comprehensive exploration aims to provide valuable insights for both patients and the general public. Understanding leukemia. To truly grasp the intricacies of leukemia, it's essential to explore the molecular underpinnings of this disease. Leukemia originates in the bone marrow when normal blood-forming cells undergo genetic mutations, leading to uncontrolled growth and proliferation of immature white blood cells. These abnormal cells, known as leukemia cells, often fail to perform their intended immune functions. Understanding the specific genetic mutations associated with different types of leukemia has become a focal point in recent research. Advances in genomic medicine have enabled scientists to identify key genetic abnormalities, paving the way for targeted therapies that aim to address the root causes of the disease at a molecular level. Subtypes of leukemia. Leukemia is not a one-size-fits-all condition. Subtypes within each major category further define the disease. For instance, acute myeloid leukemia, AML, is characterized by various subtypes, each with distinct genetic alterations. Recognizing these subtypes is crucial for tailoring treatment strategies to individual patients, thereby maximizing the effectiveness of interventions while minimizing potential side effects. Similarly, chronic myeloid leukemia, CML, is associated with a specific genetic abnormality known as the Philadelphia chromosome. The development of targeted therapies, such as tyrosine kinase inhibitors, has revolutionized the treatment landscape for CML, turning it into a chronic, manageable condition for many patients. Pediatric leukemia. Leukemia can affect individuals of all ages, but it is one of the most common childhood cancers. Pediatric leukemia, particularly acute lymphoblastic leukemia, ALL, has witnessed significant advancements in treatment protocols. Understanding the unique challenges and treatment approaches for pediatric leukemia is crucial, as the long-term effects of therapies can have profound implications on a child's development and quality of life. Lifestyle and preventive measures. While the exact causes of leukemia remain elusive in many cases, adopting a healthy lifestyle can contribute to overall well-being and may potentially reduce the risk of developing certain types of cancer, including leukemia. Avoiding exposure to environmental toxins, maintaining a balanced diet, and engaging in regular physical activity are lifestyle choices that can positively impact health and may play a role in leukemia prevention. Global impact and awareness. Leukemia, like many cancers, has a global impact, affecting individuals and communities worldwide. Raising awareness about the signs and symptoms of leukemia, promoting early detection, and supporting research initiatives are crucial for improving outcomes on a global scale. Collaborative efforts between healthcare professionals, researchers, and advocacy groups are instrumental in advancing knowledge, disseminating information, and enhancing access to quality care. Causes and risk factors. Leukemia, like many cancers, arises from a complex interplay of genetic, environmental, and lifestyle factors. While the exact causes are often multifactorial and not fully understood, certain risk factors have been identified that may increase the likelihood of developing leukemia. Genetic factors. Genetic predisposition plays a significant role in some cases of leukemia. Individuals with a family history of leukemia, or certain genetic syndromes, such as Down syndrome and Li-Fraumeni syndrome, may have an elevated risk. Understanding one's family medical history can aid in identifying potential genetic risk factors. Exposure to environmental toxins. Occupational exposure to certain chemicals, such as benzene and formaldehyde, has been linked to an increased risk of developing leukemia. Benzene, found in industries like petroleum refining and chemical manufacturing, is a known carcinogen that can affect the bone marrow's normal functioning. Minimizing exposure to such environmental toxins is a key preventive measure. Radiation exposure. Exposure to high levels of ionizing radiation, whether due to medical treatments like radiation therapy or environmental factors, such as nuclear accidents, is associated with an increased risk of leukemia. It's crucial for healthcare providers to carefully monitor and control radiation doses during medical procedures to minimize potential risks. Previous treatment for cancer. Individuals who have undergone certain cancer treatments, such as chemotherapy and radiation therapy, may face an elevated risk of developing leukemia as a secondary cancer. While these treatments are essential for managing primary cancers, ongoing research aims to develop strategies that reduce the long-term risk of secondary leukemias. Certain blood disorders, individuals with certain pre-existing blood disorders, such as myelodysplastic syndromes, MDS, are at an increased risk of developing leukemia. MDS involves abnormal blood cell production in the bone marrow, and over time, it may progress to acute myeloid leukemia, AML. Monitoring individuals with MDS is crucial for early detection and intervention. Viral infections. In some cases, viral infections have been linked to the development of leukemia. Human T-cell leukemia virus, HTLV-1, for example, is associated with adult T-cell leukemia/lymphoma. Understanding the role of viruses in leukemia development is an active area of research. Age and gender. Leukemia can occur at any age, but certain types are more common in specific age groups. Acute lymphoblastic leukemia, ALL, is more prevalent in children, while acute myeloid leukemia, AML, is more common in adults. Additionally, some types of leukemia exhibit gender disparities, with CLL being more common in men. Immune system suppression. Individuals with weakened immune systems, either due to medical conditions, for example, HIV/AIDS, or immunosuppressive medications following organ transplantation, may be at an increased risk of developing leukemia. Maintaining a healthy immune system is essential for overall health. Signs and symptoms. Recognizing the signs and symptoms of leukemia is paramount for early detection and timely intervention. The presentation of leukemia symptoms can vary depending on the type of leukemia, the stage of the disease, and individual factors. Here are common signs and symptoms associated with leukemia. Fatigue. Persistent fatigue and weakness are often early signs of leukemia. The abnormal proliferation of leukemia cells can lead to a decrease in normal blood cell production, causing anemia and contributing to feelings of tiredness. Unexplained weight loss. Leukemia may cause unexplained weight loss, often accompanied by a loss of appetite. The body's increased energy demands due to the rapid growth of abnormal cells can contribute to weight loss. Frequent infections. Leukemia impairs the normal functioning of white blood cells, compromising the immune system. As a result, individuals with leukemia are more susceptible to infections. Recurrent or severe infections may be indicative of an underlying hematologic disorder. Easy bruising and bleeding. Abnormalities in platelet production, a type of blood cell essential for clotting, can lead to easy bruising and bleeding. Petechiae, small, red-purple spots on the skin, and prolonged bleeding from minor cuts or injuries may be signs of leukemia-related platelet deficiencies. Bone pain and tenderness. Leukemia can infiltrate the bone marrow, leading to bone pain and tenderness. This discomfort is often felt in the long bones, such as the legs and pelvis. Bone pain may intensify during physical activity or at night. Swollen lymph nodes. Leukemia cells may accumulate in the lymph nodes, causing them to swell. Painful or painless lumps may be palpable in the neck, underarms, or groin. Enlarged lymph nodes are more commonly associated with lymphocytic types of leukemia. Abdominal discomfort. Leukemia can cause the spleen and liver to enlarge, leading to abdominal discomfort or a feeling of fullness. This can result in a noticeable swelling or distension of the abdomen. Excessive sweating, especially at night. Night sweats that are unrelated to room temperature or physical exertion may be indicative of leukemia. Excessive sweating is often associated with more advanced stages of the disease. Headaches and other neurological symptoms. Central nervous system involvement, though less common, can manifest as headaches, seizures, or other neurological symptoms. These symptoms may be more prevalent in cases of acute leukemia. Skin changes. Leukemia can cause changes to the skin, including paleness, redness, or the development of small, dark spots, leukemia cutis. Skin symptoms can vary widely and may be more evident in specific subtypes of leukemia. Diagnosis. Diagnosis of leukemia. Accurate and timely diagnosis of leukemia is crucial for determining the type of leukemia, its stage, and developing an appropriate treatment plan. The diagnostic process involves a combination of medical history assessment, physical examination, and various laboratory and imaging tests. Here is an overview of the key steps in diagnosing leukemia. Medical history and physical examination. The diagnostic journey often begins with a thorough medical history assessment and a comprehensive physical examination. Healthcare providers inquire about symptoms, risk factors, family history, and overall health. A physical examination may include palpation of lymph nodes, examination of the abdomen, and assessment for signs of anemia or bleeding tendencies. Blood tests. Blood tests play a central role in leukemia diagnosis. A complete blood count, CBC, measures the number and types of blood cells. Abnormal levels of white blood cells, red blood cells, or platelets may indicate the presence of leukemia. Additionally, a peripheral blood smear can provide a detailed examination of blood cell morphology, aiding in identifying abnormal cells. Bone marrow aspiration and biopsy, to confirm the diagnosis and determine the specific type of leukemia. A bone marrow aspiration and biopsy are often performed. During this procedure, a small sample of bone marrow and a core of bone are extracted, usually from the hip bone. These samples are then examined under a microscope to assess the presence of leukemia cells and their characteristics. Cytogenetic analysis. Cytogenetic analysis involves studying the chromosomes within leukemia cells. Certain chromosomal abnormalities are associated with specific types of leukemia and can influence treatment decisions. Fluorescence in situ hybridization, FISH, and other molecular techniques help identify these genetic changes. Imaging studies. Imaging studies, such as X-rays, computed tomography, CT, scans, or magnetic resonance imaging, MRI, may be conducted to evaluate the extent of leukemia and identify any organ involvement. Imaging is particularly useful for detecting enlarged lymph nodes, an enlarged spleen or liver, and assessing overall disease burden. Lumbar puncture, spinal tap. In cases where there is a suspicion of central nervous system involvement, a lumbar puncture may be performed. This procedure involves collecting cerebrospinal fluid from the spinal canal to check for the presence of leukemia cells. Flow cytometry. Flow cytometry is a laboratory technique used to analyze the characteristics of individual cells, particularly those in the blood or bone marrow. It is valuable in identifying specific markers on the surface of leukemia cells, aiding in subtype classification. Molecular testing. Advancements in molecular testing allow for a more detailed analysis of genetic mutations associated with leukemia. Polymerase chain reaction, PCR, and next-generation sequencing, NGS, are examples of molecular techniques that provide insights into the specific genetic alterations driving the leukemia. Biopsy of other tissues. In some cases, a biopsy of other tissues affected by leukemia, such as the lymph nodes or liver, may be performed to obtain additional information about the extent of the disease. Consultation with specialists. The complexity of leukemia diagnosis often requires collaboration with hematologists, oncologists, pathologists, and other specialists. A multidisciplinary approach ensures a comprehensive understanding of the disease and informs the development of an individualized treatment plan. Leukemia treatment options. Chemotherapy is the mainstay of leukemia treatment. Typically, a combination of drugs like vincristine, doxorubicin, cytarabine, etoposide, cyclophosphamide and others is used. The number of cycles and administration schedules depend on the leukemia type and patient's response. Side effects like nausea, hair loss, lowered immunity may occur. Radiation therapy utilizes high-energy X-rays to destroy cancer cells in the body. Usually the head, neck, chest, pelvis and abdominal areas are radiated. It can be given before bone marrow transplant. Bone marrow transplant allows to replace damaged bone marrow with healthy cells. The donor may be a sibling or an unrelated HLA-matched person. It's a complex procedure with risks but gives a chance for cure. Novel targeted therapies block leukemia cell growth and spread. They are typically combined with chemotherapy. Examples are BCR-ABL tyrosine kinase inhibitors, antibodies, rituximab, alemtuzumab, farnesyltransferase inhibitors. Coping with leukemia. Psychosocial support is crucial for leukemia patients. Seeing a psychologist, psycho-oncologist, social worker is advisable. Joining a support group to share experiences with other patients can help. It's important to monitor one's emotional state and express feelings. Keeping a journal, practicing yoga or meditation can help. Planning small celebrations, trips outdoors with loved ones can lift one's spirits. Getting ample rest, eating well, avoiding stress is key. Maintaining enjoyable activities like hobbies, reading, listening to music is recommended. Family and friends should provide moral support through all stages of treatment. Staying united and hopeful is what one needs. Your health matters. Quali.health